Today we're back at Florida Medical Clinic to talk to another expert in the field of orthopedic surgery, Dr. Geoffrey Cronen. He specializes in spine and spinal deformities for adults and children. He is the leader in the Southeast U.S. in spinal deformity and reconstructive surgery. Today he'll offer some skillful insight on correcting and relieving many spinal problems. Dr. Cronen, tell us your association with the Lightning.
My partner Ira Gutentag is the primary orthopedic surgeon for the team, and I take care of any spine-related conditions and fill in occasionally to cover games.
In your full-time practice here at Florida Medical Clinic, what type of spinal issues do you deal with on a daily basis?
So we see everything from acute aches and pains, several days to weeks in duration, all the way up through complex deformities. And far and away the most common thing we have to do is treat someone with oral anti-inflammatories, maybe some physical therapy, but go all the way up through surgical treatment of those complex deformities.
Do you see spinal deformities do you see them mostly at birth, or is this something as someone grows that it occurs?
They're less commonly diagnosed at birth. They're more commonly diagnosed around the time of puberty, and that's when growth happens the fastest, which is when deformities tend to change the most. And so therefore they're picked up either on physical examination in a doctor's office, or very commonly when children start wearing less clothing as it warms up outside and start hopping in swimming pools. The parents will notice that there's something amiss.
It's not the most common thing to go to the doctor for, hey, just check my spine, you know?
Part of the reason that the Adams-Ford-Bend test exists. It should be done by all pediatricians or family medicine doctors around that time when growth is picking up the most, and that can really lead a doctor to order an x-ray, which can then give the diagnosis of scoliosis.
Is that the test where they bend over and just check your spine? It's a very simple test. You don't need...
Doesn't cost anything. It takes 5 seconds to do, and can provide a great deal of information. So it's very important to make sure you check your child for spinal issues. The younger they are, the sooner they need to be treated. Even a parent can do it at home. I instruct all my parents to follow their kids. I only see them about every 6 months or so, so the parents can just, if they so choose, can have the child bend over, and there's even an iPhone app that you can assess the amount of rotation on the spine, and then mark that on the calendar what it was on this date and compare it to the next month, etc. You
specialize in extreme deformities. Talk about one of the worst cases you've dealt with.
We see a lot of pretty substantial cases. I work at the Shriners, and they come in all shapes and sizes. The model here on the table was someone who had had previous surgery, and it didn't turn out quite as was predicted, and she needed a fairly complex revision surgery involving removal of a couple of segments of vertebrae, and she ultimately did well and has gone on to have a relatively normal life afterwards, getting married and having children, etc.
Wow, so you can take a spine that's so much deformed and make them fairly normal.
It's certainly the life-threatening aspect of their condition can be stabilized, and they can live a normal life otherwise.
Is there any particular surgery that you do that you see great results from?
The best results are people who have very simple problems compared to things like this, such as a disc herniation either in the neck or the low back. Those surgeries are satisfying when the patient has primarily arm or leg pain, and really little or no neck or back pain. The disc fragment is removed and the pressure is taken off of the nerve, and the pain goes away, and the patients generally are ecstatic. It's a simple surgery. It takes very little time to do, and generally is done as an outpatient. So a symptom that has a tremendous impact on somebody's life, negative impact, can be relatively simply treated, and they can return to a pretty normal life.
There aren't a lot of surgeons who do what you do and specialize in such deformities. I think Tampa Bay, we should feel very lucky and blessed to have someone like you at Florida Medical Clinic who can take care of issues like these.
Thank you. There are a handful of other surgeons around the area that do take care of deformities, and they're all gifted and talented surgeons. But it does take someone who's either a little off their rocker to tackle cases like this. because they are very challenging, but the results can be very satisfying.
Any predictions for this year's lightning season?
Wow, we really look good. Stamkos had a hat trick last night, which was very exciting for the whole arena, but especially my 11-year-old daughter who loves hockey. So yeah, we're looking good. Hopefully no injuries that I or Ira will have to take care of, and we could go far.
Do you often see spinal injuries with hockey players?
The most common thing is acute low back pain that needs a little bit of therapy or chiropractic intervention, something along those lines. And the team has a whole host of people to treat those things, of which we're included. And so they generally get back to relative norm fairly quickly. Occasionally there will be someone who has something like a disc herniation who needs a relatively minor surgery, but those can keep them out of play for up to a couple of months afterwards.
The Department of Orthopedic Surgery here at Florida Medical Clinic can treat a wide range of spinal conditions by utilizing state-of-the-art rehabilitation technology. Did you know they're also the official team physicians for the Tampa Bay Lightning? That's just one more great reason to consider coming to Florida Medical Clinic for orthopedic care. And as always, a wide range of information is available to you by going to their website at floridamedicalclinic.com.